the one thing I've heard you say more than once, out of all the different hurdles that you had to jump through and all those different roles that you've played, is you said the CIO was the hardest. And I'd like to understand why do you say that?
Well, specifically, I would say the CIO in healthcare is the hardest job I've ever done. That's now being a busboy was not all that easy, to be honest with you, for me. And I worked a UPS job over the summer while I was in college. But the CIO role in healthcare is so complex because when you think about it, who else can you go to and say, hey, let's talk about clinical workflows, and the CIO has to be able to do that. And hey, let's talk about supply chain, and they have to do that. Hey, let's talk about finance. Hey, let's talk about claims processing. Hey, let's talk about you name it. We have to at least understand it at a base level across the board to be able to lead the organization. And so that aspect of it was challenging. And because I'm not a sitting CIO, I'll say this. The politics of it were hard. I was a 16 hospital system, and there was always something that somebody wanted to do that someone else didn't want to do. And a lot of the role is helping to bridge that gap, helping either these people to understand why we really can't do it or shouldn't do it, or helping these people to understand why this is in the best interest of the health system. So it's challenging because it requires, left brain and right brain, right? It requires negotiation skills, leadership skills. It requires technical acumen. It requires so many things. And to be honest with you, when you come in every day, you sit down at your desk. I used to come in at about 5 o'clock. I'd get to my desk because I wanted to get my work done before everybody else started showing up, because the rest of my day just never went the way I thought it was going to go. There was always something going on. So it's, far and away the hardest job I've ever had.